Idaho's News Channel 7. This is the News at 6.
Welcome to the News at 6. I'm Morgan Romero. Today, the state reports 3,002 new coronavirus cases. It's important to note these numbers are both from today as well as Sunday. That's up from Saturday's report of 1,945 new cases. 9 more Idahoans died from the virus, and the number of backlogged positive results is now up to almost 40,000. The state calls those outstanding positive tests pending review by local health districts. Most of southern Idaho is reverting back to crisis standards of care. The Idaho Department of Health and Welfare made that announcement this morning. They say staffing crunches and blood shortages impact local hospitals and their ability to provide care. Andrew Bartline spoke with the South Central Public Health District, which covers the Twin Falls area, as well as the American Red Cross. Andrew, tell us what they're most concerned about.
Well, there are some hospitals that are still operating normally, you could say, under crisis standards of care, but this staffing strain is really stressing them. Along with this, it's coupled with a blood shortage. American Red Cross says it's one of the worst in a decade.
Citing severe staffing and blood shortages, the Idaho Department of Health and Welfare activated crisis standards of care in 3 local health districts. It includes Southwest District Health, Central District Health, and South Central Public Health District.
It's a crucial time. It's an important, but it's a crucial time.
South Central's Public Information Officer, Brianna Bodley, covers the Magic Valley area. She says none of the 5 hospital systems in her region need to operate under crisis standards at this moment, but staffing shortages have them at the brink. Bodley says there are currently no available ICU beds in her district.
If we run out of space in our hospitals, it will be very difficult to find other hospitals that can take on those patients.
Bodley says some of her biggest concerns are for non-COVID patients, ones that need blood. The American Red Cross says we are amid the largest blood shortage in more than a decade, and that can have very real impacts on hospitals.
It's putting hospitals in a difficult situation. They're having to make difficult decisions that they don't want to be making.
What do some of those decisions look like?
You know, when the demand is greater than the resources, some treatments may have to be delayed. You know, they're going to have to decide who gets blood and who may have to wait for blood.
Bodley says the winter months are popular for falls, accidents, and car wrecks. And with her region's hospital systems getting pushed to their limits, she asks the public to be mindful.
We're in a 2-year pandemic. This hasn't gone away yet. We have a lot of illnesses circulating, and we have other things impacting our have to end up in the hospital later or just on your sick bed, wishing that you had done that and prevented whatever you might go through.
Now, we reached out to Health and Welfare and St. Alphonsus. We haven't gotten any further answers. We do know there is a media briefing scheduled for tomorrow. Traditionally, that's been a time where we get these answers from the hospitals and in Health and Welfare about what's going on in our region health-wise. So we were deferred to the media briefing tomorrow to get those further answers. Morgan?
Yeah, we'll definitely get more clarity tomorrow. Andrew Bartline reporting live for us. Andrew, thank you. Happening right now, this is a live look at the West Ada School Board meeting underway. The state's largest school district is meeting to talk about their COVID policies, among other things. West Ada will hear 30 minutes of public testimony on their COVID protocols. You can watch it live right now on our website, ktvb.com, where we're streaming it. And tonight on the News at 10, our Katya Stepovic will have more from the community and details on any decisions that the board makes tonight.